Morning, class. So today we're going to be going over Chapter 11, Principles of Pharmacology. So pharmacology applies fundamental knowledge of the medications that the EMT may assist administer to a patient during an emergency. Principles of pharmacology: medication safety, kinds of medications used during an emergency. Medication administration: self-administer medication, peer-administer medication, assist administer medication to a patient. So for EMTs, the only drugs you're really going to be administering are going to be aspirin and oxygen. If the patient has their own nitroglycerin, you could assist with their medication. Emergency medications: so names, effects, actions, indications, contraindications. So when would you give aspirin to somebody? It's probably going to be somebody complaining of chest pain and cardiac nature. Contraindications for chest pain: for somebody that you want to give aspirin to is going to be a current GI bleed. Just because they've had a GI bleed in the past doesn't preclude them from you giving them aspirin. You could still give them aspirin. It's only if it's active. And of course, if they're allergic to aspirin, that's another contraindication of why you shouldn't give a medication to somebody. Okay, so complications, routes of administration, side effects, interactions, dosages for the medications administered. So you want to understand the side effects when you give medications to somebody. So for instance, nitroglycerin. If you give that to a patient, their blood pressure is probably going to drop. They might start having a headache, things of those natures. And you need to know the dosages for each medication that you're going to give. So dosage for aspirin is going to be 81 to 325 milligrams of aspirin. Nitroglycerin is 0.4 milligrams. And routes of administration: how do you give that person the medication? Do you give it orally? Do you give it sublingually? So medications are an important intervention. Medications may alleviate pain and improve the patient's condition. Failure to administer medications safely and competently can lead to serious consequences for the patient, including death. As an EMT, you will administer medications, help patients self-administer medications such as nitro, ask patients about medication use, report patient information to hospital personnel. So you always want to ask patients, what kind of medications are they taking? That gives you a little bit of an insight into what medical problems they have, what their medical history is. Because a lot of the times people don't understand why they're taking medications. They just say, my doctor told me to take this. I don't know what it's for. So if you understand pharmacology and you understand the different types of drugs and what they're used for, you kind of decipher what medical history, medical problems that the patient might have. And then you also want to report that patient information to hospital personnel. So always, 3 questions you're always going to ask is, do you have any allergies to any medications? Do you take any medications? And what kind of medical problems do you have? Okay, so how medications work. Pharmacology is a science of drugs. A medication is a substance used to prevent or treat disease, relieve pain. Pharmacodynamics is a process by which medications work on the body. Okay. Agonist causes stimulation in receptors. Antagonist binds to a receptor and blocks other medications or chemicals. Dose, amount of medication given, depends on weight, age, desired action. So for instance, an antagonist, for people who have heroin overdoses, we're going to give them Narcan. Not specifically for an EMT, you guys aren't allowed to give that. But it blocks the receptors for heroin. And the dose, the amount of medication given, most of the time for adults it's going to be a set amount of medication given. For pediatrics, it's going to be probably weight-based. So milligrams per kilo, or however the drug is the amount of medication in there. Okay, so action, therapeutic effect. How is it supposed to work? Indications, reasons or conditions to give that patient the medication that you want to give them. Contraindications, harmful effects, absolute and relative. So absolute contraindications are something that you do not want to give medications for. So say if you want to give nitroglycerin to somebody who's taken an ED med within the past 24 hours, that's an absolute contraindication. Side effects, unintended effects, untoward effects. So medication names. The generic name is a simple, clear, non-proprietary name. Example, ibuprofen. The trade name is the manufacturer's brand name. One drug may have more than one trade name. Example, Tylenol. So prescription medications, over-the-counter medications or OTC, recreational drugs, herbal remedies, enhancement drugs, vitamin supplements. Routes of administration, enteral medications enter the body through the digestive system. Parenteral medications enter the body by some other means. So you always want to know how a drug is given and how it reacts in the body. Absorption is the process by which medications travel through body tissues to the bloodstream. Common routes of administration: per rectum, PR by rectum, oral or POS, per OS, PO by mouth. Common routes of administration: intravenous IV into the vein, intraosseous into the bone. I've shown you guys a couple videos on how we do IOs out in the field for a paramedic. You either do them in the shin bone or you could do them up in the humerus as well. And even in the chest out in the military field, you could do that. So subcutaneous, beneath the skin. Intramuscular, IM, into the muscle. So these are good abbreviations to understand when you're starting out in the medical field, so you could know which route medications are given. So is it IV, IO, SC, or IM? So inhalation, inhaled into the lungs. So say if somebody has asthma and they have a inhaler, sublingual, under the tongue. So nitroglycerin is given sublingually. It's going to be given underneath the tongue and it's going to dissolve. Transcutaneous, transdermal, through the skin. So in Monterey County, if we have somebody who's on CPAP and we have a long transport time, longer than 20 minutes, we could give nitro, like a nitro paste, just on their chest. Intranasal, IN, into the nostril via a mucosal atomizer device. So for paramedics, we do Versed for seizures, IN. For Narcan, we do, for heroin overdoses, we could do IN as well. So, and you also have to know how fast the medications work, depending on which route you give it to. So sublingual goes rapidly. Per rectum goes rapidly. By mouth, PO is kind of slow because it's got to work its way down to the stomach and digest. Okay, intravenous and IO are immediate because you're going right in the bloodstream. Inhalation rapid. Okay, intranasal is rapid too. Intramuscular is a little bit slower, and subcutaneous and transcutaneous are slow. So the form of medication usually dictates the route of administration. The manufacturer chooses a form to ensure proper route of administration, timing of the medication's release into the bloodstream, effects on the target organs or body systems. Basic forms: tablets and capsules, solutions and suspensions, metered dose inhalers, topical medications, transcutaneous medications, gels, gases for inhalation. Capsules are gelatin shells filled with powdered or liquid medication. So if you guys have ever taken Tylenol or Advil, sometimes they come in a capsule, kind of a soft form that has the medication inside. Tablets often contain other materials that are mixed with the medication and compressed. Solutions and suspensions. A solution is a liquid mixture of substances. Mixture will not separate by filtering or letting it stand. Many solutions can be given as an IV, IM, or SC injection. So remember, what three routes are those? You have IV, intravenous, IM, intramuscular, and SC, sub-Q or subcutaneous. A suspension is a substance that does not dissolve well in liquids. It will separate if it stands or is filtered. Meter dose inhalers. Liquids or solids broken into small enough droplets or particles may be inhaled. A meter dose inhaler, MDI, directs such substances through mouth into lungs. Delivers the same amount each time. So remember, delivers the same amount each time, so meter dose inhaler. So it gives a certain amount of medication. Okay, and obviously I think most of you guys have seen an inhaler before. Topical medications includes lotions, creams, and ointments applied to skin surface and affect only that area. Examples: lotion, cream, hydrocortisone cream, ointment, neosporin ointment. Transcutaneous medications designed to be absorbed through the skin, also referred to as transdermal, may have systemic effects. So examples: nitroglycerin paste. We talked about this earlier, and for long transports we give nitroglycerin paste for people on CPAP. Adhesive patch. If you touch the medication with your skin, you'll absorb it just like the patient. So this is one thing to look out for. If a patient has a patch on, you don't want to touch anything with your bare hands. Remember BSI? Semi-liquid, administered in capsules or through plastic tubes. Example: oral glucose for a patient with diabetes. Gases for inhalation outside the operating room. Most commonly used is oxygen, usually delivered through a non-rebreather mask or nasal cannula. So how much oxygen do we give for a non-rebreather mask? About 10 to 15 liters per minute, right? What about a nasal cannula? About 2 to 6 liters per minute. So general steps in administering medications. Medications should be administered only under the authorization of medical control. So depending on which county you work in, you need to know what medications you're allowed to give or assist with. Anything besides that is outside of medical control, and you could be in trouble. You could have your license under review for giving a patient a medication that's not under protocols. So follow the 6 rights of medication administration. Medication errors almost always result from failure to follow these 6 rights. So every time you give a medication to somebody, you want to think about your 6 rights. Right patient. Does this drug work for this patient? Okay, so right medication. Is the medication I'm giving actually going to help their medical problem? Right dose. Remember, you have to know what the dose is for each medication that you're going to give. So aspirin is 81 to 325. Nitroglycerin is 0.4 milligrams. Okay, right route. You have to know which route medications are given. Aspirin's going to be given orally. Nitroglycerin is going to be given sublingual or SL. And right time and right documentation. So always document everything you do. If you don't document what you did, then it didn't happen, didn't occur. Medication and administration in the EMT. Unit may carry oxygen, oral glucose, activated charcoal, aspirin, epinephrine. Okay. So these are kind of your standard national NREMT medications that you can carry along with you, but you have to follow your county protocols. Circumstances in which medications may be administered: peer assisted administration, patient assisted administration, EMT administered medications determined by state and local protocols, medical control. So patient assisted administration, you could assist the patient with their own nitroglycerin. EMT administered medication. So you carry oxygen, you carry aspirin. These are things that you can administer. Medication used by EMT is the state department and medical director will define which medications are carried on your ambulance. So oral medications. Advantages: ease of access, comfort level. Disadvantages: the digestive tract can be easily affected by food, stress, and illness. Speed of movement through the tract dramatically changes the speed of absorption. Confirm that the patient has a patent airway and is able to swallow, and then instruct the patient to swallow or chew the medication. So if you're going to give somebody a medication orally, they have to have a patent airway. They have to be able to protect their own airway. If the patient's altered or unconscious, you're probably not going to give a medication orally, because they're probably going to aspirate, and it's going to make the problem even worse. So activated charcoal reduces the amount of medication being absorbed. Ground into fine powder, frequently suspended with sorbitol. Administer by mouth. Do not give to patients with altered level of consciousness. So like I just said, you're not going to give any oral medications to patients with altered level of consciousness. If they can't protect their own airway, you're not going to give them medication orally. So oral glucose, a sugar that cells use for energy, treats hypoglycemia. EMTs give it only by mouth. Do not give to an unconscious patient or one who cannot protect their airway. So for us, we carry oral glucose, and then for the medic side, we carry D50, and we also carry glucagon. So those all treat hypoglycemia. For our county, anything under 70 is going to be considered hypoglycemia, and we have to give some type of sugar for the hypoglycemia according to our protocols. And you want to go the route with least resistance. So oral glucose, I'm going to start there. If the patient has a patent airway and they can protect it and they're conscious, then I'm going to give them oral glucose. If they're altered or unresponsive, I'm going to hold off on the oral glucose. So aspirin reduces fever, pain, and inflammation, inhibits platelet aggregation, so useful during heart attack. So during heart attacks, the clotting has already started in the heart, and it's reducing blood flow, and your cardiac cells are going to start to die. So this is the reason why we give aspirin, to make sure the clot doesn't get any bigger. And the contraindications for that are hypersensitivity to aspirin or allergies to aspirin, liver damage, bleeding disorder, or asthma. Should not be given to children. So if the patient has an active GI bleed or a gastrointestinal bleed, you're not going to give them aspirin. Sublingual medications. Advantages: easy to advise patients, quick absorption. Disadvantages: constant evaluation of the airway, possible choking, not for uncooperative or unconscious patients. So which medication do you guys think we give sublingually? So nitroglycerin is a sublingual medication. Nitroglycerin relieves angina pain for cardiac patients, increases blood flow, relaxes veins. So nitroglycerin could come in a couple different ways. They could either have a spray right up here or a very small tablet that you, they're both going to be sublingual for that. So, and then if you guys could see right here, I don't know if it's going to be big enough for you guys or not. That's how much the medication is. So 0.4 milligrams. Okay, and then also says it's a little smaller and a little harder to read, but sublingual tablets. And then it should have probably an expiration date somewhere around here and over here. If the medication's expired, are you going to give it to them? No, you're not going to give patient any expired medication. That's a contraindication. So before administering, check blood pressure, obtain order to administer. So you're always checking vital signs. You want to check vital signs before you start giving patients medications, especially medications that could drop a patient's blood pressure. So in our county, it's going to be 110 blood pressure, a minimum that we have to have for a patient before you give nitroglycerin. I'm not sure what your book says. It might be 100, and depending on what county you're in. You got to make sure you know how much your blood pressure is. So it's used for possibility of MI or myocardial infarction or heart attack. If no relief, should not be used with erectile dysfunction medications. So erectile dysfunction medications, they also cause a drop in blood pressure. So those two combined can cause an unsafe drop in blood pressure. May cause mild headache. So administration by tablet, sublingually, under the tongue. Slight tingling or burning. Storage is important. Administration by metered dose spray, on or under the tongue. 1 spray equals 1 tablet. So in the 2 pictures you saw earlier, the bottom picture was a tablet, and the one on the top is a metered dose spray. So you guys have to know how many sprays you're going to give. So 1 spray equals 1 tablet. So know your medications before you start work. Go through your medications, understand how they come, how they work, how they're administered before you get on scene and you try and give a patient a medication. So administration considerations for both tablet and spray. Wait 5 minutes before repeating dose. Monitor vital signs. Wear gloves. Know local protocols. So for nitroglycerin, once the patient's medication has been dissolved, after about 3 to 5 minutes, if they don't have any relief, you're going to take another blood pressure, and if the blood pressure is still high or above the 110 mark or the 100 mark, or whatever the county protocol says you guys have to have, you guys may repeat. If the patient's blood pressure dropped more than 30 points, that might be another contraindication that you don't want to give them a second dose or a third dose. So always monitor vital signs as well. This creates a trend. Wear gloves. BSI, know your local protocols. So intramuscular medications, advantages: quick, easy access without using vein, stable blood flow to muscles. Disadvantages: use of the needle and subsequent pain. Patients may fear pain or injury. So this is another one. A lot of people don't like needles, especially if you're going to use epinephrine, and you got to put it on either their thigh or their arm. They're probably not going to be happy with you. So epinephrine controls fight or flight response. Primary medication for delivery is IM, or intramuscular, also called adrenaline, released inside the body under stress. Sympathomimetic. Okay. Increases heart rate and constricts blood flows. Do not give to patients with hypertension, hypothermia, MI, or wheezing. May be delivered with an auto-injector to treat life-threatening anaphylaxis. What's anaphylaxis? Anaphylaxis, allergic reaction. So for anybody who's allergic to peanuts or who has any other kind of allergies, they're probably going to have an EpiPen on them at all times. So, allergens cause body to over-release histamine. Epinephrine acts as an antidote to reverse the effects of histamine, dispensed from an auto-injector. So right here, he's got an EpiPen. And usually you have to put enough force where there's like a spring-loaded needle in here that's going to push back into the thigh and give the required dose. For a kid, it's going to be 0.15 to 0.3 milligrams for your dose of epi. For an adult, it's going to be 0.3 milligrams. Naloxone, so also called Narcan. Remember, there's a couple different names or terms for each medication. You have the trade name, you have the brand name, you have the generic name. So use the reverse effects of an opioid overdose. Important considerations: consult medical direction. Effects may not last as long as opioids. Repeated doses may be necessary. Can cause severe withdrawal symptoms. Consider your safety. So I normally give Narcan IN. It's the fastest route. It's probably the easiest route instead of trying to look for a vein. But fentanyl is hitting the streets a lot more now, and it's causing our Narcan not to be as effective when we have to give repeated doses. So always protect the airway. Know how many doses you could give before you have to call and ask a doctor or medical control for more Narcan. The most common technique for naloxone administration is via the intranasal route. So right here, you're gonna pull up the medication in a syringe, and you're gonna have what's called a mucosal atomizer device, and you're gonna push this kind of hard up the patient's nose. So oxygen, all cells need it to survive, generally administered via non-rebreathing mask, preferred method. Nasal cannula in patients who cannot tolerate a mask or who only need a little bit of oxygen. MDIs and nebulizers, liquid turned into mist or spray. Medication breathed in and delivered to alveoli, fast absorption rate, easy route to access, portable. So right here is a handheld nebulizer. So the patient breathes in the medication through here, the mouthpiece, and all the medication right here is kind of a clear tube. So the medication is going to sit right in here. It's going to be connected to oxygen, probably about 6 liters a minute, and it's going to turn it into kind of a mist. And the patient's supposed to inhale. Put his mouth on there, inhale, and then blow out. And we also have mask nebulizers. I usually prefer giving somebody a mask nebulizer. If they're struggling to breathe right now, I'm not gonna make them hold on to a nebulizer. I'm gonna just go ahead and put them on a mask. Make it a little bit easier for them. So use a spacer to avoid spray misdirection. It fits over the inhaler like a sleeve. Patient sprays a prescribed dose into the chamber and then breathes in and out of the mouthpiece. Especially useful with young children. Small volume nebulizers, easier to use than MDIs. Take longer to deliver medication. Require an external air or oxygen source. More effective in patients with moderate to severe respiratory distress. Can be used while a patient is on CPAP and during BVM ventilation. So right here, she's got a handheld nebulizer. You see the oxygen tubing coming down right here. She's holding on to it. Sorry about that, class. So she's got a handheld treatment. Medication is going to be right in this little tube right here. And then she's got the mouthpiece. Okay? So anybody with wheezing or possible allergic reaction, you're going to give them a breathing treatment. Patients use rescue inhaler MDIs to relieve bronchial spasms quickly. Maintenance or controller inhaler. The only medication that is effective during an acute attack of shortness of breath is fast-acting rescue inhalers. Patient medications. Patient assessment includes finding out which medications the patient is taking. It provides vital clues to the patient's condition. Guides treatment. Will be useful to the emergency department. So always ask. The 3 questions you're always going to ask on every call is allergies, meds, and history. Sometimes people have a big old Tupperware container that has a bunch of medications. Sometimes they have a list written down, and you could always ask them, can you give me your list of medications? Do you have it written down? So medication errors. Inappropriate use of a medication that could lead to patient harm. May be possible to minimize errors if circumstances are understood. Ensure the environment does not contribute to errors. If a medication error occurs, provide appropriate patient care. Notify medical control. Follow protocols. Document thoroughly, accurately, and honestly. Talk with your partner, supervisor, or medical director. So if you administer a medication wrong or you give them too much of a medication, make sure the patient doesn't deteriorate. Notify medical control if the patient does deteriorate. Follow your protocols. You want to document everything. Don't try and hide it. Talk with your partner. Okay, so review. Pharmacology is defined as the so break it down. Remember terminology. What does pharma mean? What does ology mean? So B, pharmacology is a field of science that deals with the study of drugs and medications. Okay, so study of cells and tissues. This is physiology, which is a branch of biology. So biology is a study of life. So effects of medications in the lungs. Pharmacodynamics, which includes the processes of the body's response to medications. So pharmacokinetics, which studies medication distribution within the body, distribution of drugs to the body's tissues. How does it react when a drug is given to a patient? Which of the following statements regarding medications is false? Many medications are known by different names. So all medications have a few different names, right? Trade names, brand names, generic names. Some medications affect more than one body system. Over-the-counter drugs must be prescribed by a physician. EMTs should ask about any herbal remedies or vitamins that the patient may be taking. When you go to the pharmacy for, well, probably not nowadays, but cold medication or even Benadryl, can you just go ahead and buy that? Do you have to go talk to a physician about getting a prescription for it? Probably not. So over-the-counter drugs such as aspirin, Tylenol, Motrin do not require physician prescription. They can be purchased at a supermarket or drugstore. Most medications have a generic name and a trade name. So, for example, acetaminophen is a generic name for Tylenol, and ibuprofen is a generic name for Motrin. So, which of the following routes of medication administration has the fastest effect? So, do you guys remember that table on how it shows the different routes and how fast each one is? Which one do you think is going to be the fastest? And can you guys do that out in the field as an EMT? Okay, so B, because its administration is directly into a vein, a drug given intravenously enters the body quickly. The intravenous route is the fastest acting of all the routes of medication administration because it's straight into a vein. So if you give a medication orally, medication must be absorbed through the mucous membranes first to get into the circulatory system. So subcutaneous medication must pass through the layers of skin before reaching the circulatory system. Intramuscular, the medication needs to travel to the circulatory system. When administered to a patient, a meter dose inhaler will So what's a meter dose inhaler used for? It's used for patients with asthma or wheezing, right? So we're going to cancel that one out. A metered dose. So remember, what does metered mean? The same one every time, right? So deliver a different dose each time. That's going to be no. So be delivered to the lungs over a period of 6 to 8 hours. That's going to be no too. Okay, so we're going to go with A. The metered dose inhaler delivers the same dose of medication each time that it is used. Drugs given via the MDI act very quickly and are commonly prescribed to patients with asthma, emphysema, and other airway diseases. So you're managing a 62-year-old woman who complains of crushing chest pain. Her blood pressure is 84/64, and her heart rate is 110 beats per minute. Medical control advises you to assist her in taking her prescribed nitroglycerin. After receiving this order, you should... So anytime you're given an order and either you're unclear about it or it goes against your protocols, what's something you could do? Or what's something you should do after getting an order every single time? Repeat the order back and then let the medical control person know what the contraindications are. You have to be a patient advocate for your patient. If you're gonna give a medication that's gonna deteriorate her condition, you need to let the hospital know. Sometimes transmissions get cut off, sometimes cell phones drop, and they didn't get that part of the blood pressure. So what do you think the best option is for that? B. Nitroglycerin is a vasodilator and lowers blood pressure. Therefore, it should not be given to patients with a systolic BP less than 100. So if you receive an order to give nitroglycerin to a patient with systolic blood pressure less than 100, you should ensure the physician is aware of the patient's BP, then reconfirm the order. So remember, patient advocate, you want to let the physician know patient's BP is too low. It goes against protocol. And then reconfirm the order. So activated charcoal is indicated for patients who have ingested certain drugs and toxins because it How does activated charcoal work on the body? So D, activated charcoal is adsorbent. That is, it binds to harmful chemicals that have been ingested. This binding effect delays digestion and absorption of the chemical by the body. So with regard to pharmacology, the term action refers to what? So D, as it applies to pharmacology, the term action refers to the effect that a drug is expected to have on a patient's body. Prior to administering any drug, the EMT must be aware of its actions on the body. Which of the following patients is the best candidate for oral glucose? So what are the indications that you could give somebody oral glucose? What are the contraindications? So contraindications is somebody who doesn't have a patent airway, who's altered. So when do you give oral glucose? To which type of patient? So an unconscious diabetic patient with low blood sugar, with the documented low blood sugar. Are you going to give that? Do they have a patent airway? Are they alert? Probably not. So conscious diabetic patients suspected of being hyperglycemic. What does hyperglycemic mean? Do we give oral glucose to somebody with high blood sugar? So semi-conscious patient with signs and symptoms of low blood sugar. Is the patient fully conscious? No, they're semi-conscious. So conscious patient who's showing signs of hypoglycemia, it's going to be A. It should not be given to unconscious patients or those who are otherwise able to swallow because it may be aspirated into the lungs. So epinephrine is given to the patients with anaphylactic shock because of its effects of What does epinephrine do for the body? Or we could back that up. What does an allergic reaction happen? What does the body do for an allergic reaction? The vessels dilate. They start leaking fluid. They start third spacing. The bronchioles constrict. You start having wheezing. So to counteract that, epinephrine is going to do the opposite, right? So B, the two major complications associated with anaphylactic shock are bronchoconstriction, which impairs air movement in and out of the lungs, and vasodilation, which causes a drop in blood pressure. Epinephrine reverses these processes by causing bronchodilation and vasoconstriction, thereby improving breathing and increasing the blood pressure, respectively. The process by which medications travel through body tissues until they reach the bloodstream is called C. Process by which medications travel through body tissues until they reach the bloodstream is called absorption. Adsorption refers to the binding of one chemical to another. So activated charcoal, for example, delays absorption of certain chemicals into that bloodstream because it adsorbs, binds to them in the stomach. It acts as a sponge, basically. So if somebody overdose on pills within the hour, we could give them activated charcoal, and it adsorbs to the pills in the stomach. It acts as a sponge.